Medicaid Challenges, Reforms, and the Future of U.S. Healthcare. This is presented by Jasmine Luna, attending California Baptist University for Finance and Reimbursement in Healthcare class, taught by Professor Dr. Greg Garza. Agenda: Introduction to Medicaid, History and Structure, Populations Covered, Key Issues and Challenges, Financing and Reimbursement, Innovations and Alternatives, Policy Recommendations, Conclusion, and References. Introduction to Medicaid, largest public health insurance program in the U.S., covers low-income families, elderly, disabled, and children. Joint federal-state program requiring coordination. Medicaid is the largest public health insurance program in the United States, serving low-income families, the elderly, people with disabilities, and children. It operates as a joint federal-state program, which means that while the federal government sets certain requirements, states have flexibility in how they run their programs. Chittenbaum and Tolbert, 2025. This flexibility allows Medicaid to adapt to local needs, but also leads to variations in access and coverage. The program plays a critical role in ensuring that vulnerable populations have access to both preventative and medically necessary services. Medicaid, the most extensive public health insurance program in the United States, plays a vital role in delivering health care to vulnerable populations. It faces significant challenges in financing, reimbursement structures, and care delivery efficiency that require innovative administration and policy reform to ensure long-term sustainability and equity. Policy change can truly make a difference in underserved communities. Medicaid's role in healthcare ensures access to preventative and medically necessary services, protects vulnerable populations from financial hardship, supports public health efforts through partnerships. Chittenbaum and Tolbert, 2025. Medicaid not only provides health coverage but also functions as a key driver of public health. By covering preventative care, maternity care, mental health services, and long-term care, it reduces health disparities and supports healthier communities. Many public health initiatives, such as vaccination programs and chronic disease management, rely on Medicaid funding and coordination with local providers. Chittenbaum and Tolbert, 2025. This makes Medicaid a cornerstone of the U.S. healthcare safety net. History of Medicaid. Medicaid was created in 1965 through the Social Security amendments alongside Medicare. Originally, it was limited to specific groups like people receiving public assistance, but expansions in the 1980s and 1990s extended coverage to more low-income pregnant women, children, and individuals with disabilities. The Affordable Care Act in 2010 was a major turning point, allowing states to expand Medicaid eligibility to adults up to 138% of the federal poverty level. However, the 2025 Big Beautiful Bill has introduced new funding cuts threatening access for millions across the United States. Medicaid enrollment growth. Since its inception in 1965, Medicaid enrollment has grown from about 4 million people to over 80 million in 2025. This growth reflects policy changes, economic factors, and expanded eligibility under the ACA. Expansion rates have seen particularly high enrollment increases. demonstrating the program's importance in reducing uninsured rates. This chart shows that Medicaid's role in providing coverage has steadily increased over the decades. We can definitely see how much it really had a growth from 2010 to 2025. ACA expansion extended eligibility up to 138% of federal poverty level, reduced uninsured rates, especially among low income adults. CMS 2024. The Affordability Care Act allowed states to expand Medicaid eligibility to adults earning up to 138% of the federal poverty level, leading to millions gaining coverage. CMS 2024. Expansion states saw reductions in uncompensated hospital care, better access to preventative services, and improved population health outcomes. However, some states chose not to expand, which has left significant coverage gaps in those regions. Current structure: joint federal state funding via FMAP formula. Eligibility varies by income, disability, pregnancy, and age. Managed care covers 75% of enrollees. Mutamala et al. 2024. Medicaid is structured as a partnership between the federal government and individual states, with funding determined by the Federal Medical Assistance Percentage, FMAP. Eligibility is based on income, disability, pregnancy, and age, but states may set additional criteria. Managed care now covers about 75% of beneficiaries, aiming to improve efficiency and care coordination. Mutamala et al. 2024. These plans receive a fixed monthly payment for each enrollee, which encourages most cost control and care coordination. Managed care is now the dominant model in most states, with the goal of improving outcomes and efficiency by promoting preventative services and integrated care. Federal state funding. The FMAP determines how costs are shared between the federal government and the states, with lower income states receiving a higher federal match, according to Mitchell. This formula ensures that states with fewer resources can still provide essential services. However, funding cuts like those in the 2025 Big Beautiful Bill could disrupt this balance and strain state budgets. Please refer to the graph showing in orange what the state share of medical spending is, and in blue what the federal spending is. It will be showing year 2015, 2020, and 2025. And it is shown in percentage. Populations covered. Medicaid covers a diverse range of populations: children, low-income adults, people with disabilities, the elderly, and pregnant women. For children, Medicaid provides comprehensive health services and currently covers about 40% of all children in the U.S., according to the Children's Hospital Association. Each group has a unique health needs, which Medicaid addresses through both mandatory and optional benefits. As we stated, low-income children are covered by about 40% of the children in the U.S. Low-income adults are at a range of 30%. Elderly is at a range of 10%, and disabled populations at a range of 20%. Pregnant women are not shown on this graph. Responsibilities: provide preventative and essential medical care, protect vulnerable groups, support state public health efforts, protect the financial well-being of vulnerable populations. Mutamala, Hinton, Burns, Tolbert, and Rudowitz, 2024. Medicaid's primary responsibilities include providing access to preventative care, protecting vulnerable populations from catastrophic health expenses, and supporting public health infrastructure. This means ensuring that low-income populations can access essential healthcare without facing financial ruin. Medicaid is more than a health insurance program. It is a key mechanism for promoting equality, protecting vulnerable groups, and supporting the nation's public health infrastructure. Through comprehensive coverage, access to essential services, and financial protection, and a focus on disparities, Medicaid fulfills its mission to serve low-income Americans. As healthcare needs evolve, Medicaid's role remains essential to both individuals and the broader healthcare system. Impact on healthcare delivery. According to Chadambaram and Tolbert, Medicaid has expanded access to healthcare for millions, particularly for low-income adults, the elderly, and people with disabilities. It has reduced the burden of uncompensated care on hospitals and increased utilization of primary and behavioral health services. Managed care models have encouraged integration of care, improving efficiency and outcomes, and also expand primary and behavioral health access, reduce uncompensated care burden on hospitals, and promoted integrated care via MCOs. Issue number 1: low reimbursement. Medicaid reimbursement rates are significantly lower than those on Medicare or private insurance, which discourages providers from accepting Medicaid patients. Only 45% of physicians accept new Medicaid patients compared to 94% for private insurance, according to Hsiang et al. This contributes to long wait times and limited access, especially for specialty care, and it does pose a threat to many underserved communities that might have a hard time finding medical providers or might not have a medical provider that can see them at a close proximity. This could impose added financial factors to patients. As you can see in the graph below, there is a big disproportion on patients that have Medicaid and those with private insurance, and how physicians accept new patients. Rural access issues. Rural areas face greater shortages of Medicaid accepting providers. Patients travel long distances or forego care. MAC-PAC 2021. Rural areas face unique challenges, including fewer healthcare providers overall and long travel distance for care. Medicaid patients in rural areas are more likely to experience delays and difficulty finding providers willing to accept them, according to the MAC-PAC 2021. These challenges compound existing disparities in rural health. Limited access to care is even more pronounced in rural and underserved communities, according to the Medicaid and CHIP Payment and Access Commission, MAC-PAC 2021. rural residents are disproportionately reliant on Medicaid due to lower rates of employer sponsored insurance and higher poverty rates. However, these communities often lack sufficient healthcare providers, especially specialists. MAC PAC 2021 states rural areas face persistent provider shortages, which forces patients to travel long distance or forego care altogether. These barriers intensify the access issues already documented in national studies and further isolate Medicaid patients who live outside urban centers. Issue number 2, state discretion. According to Burns, states have significant control over eligibility criteria and optional benefits, leading to wide variation in Medicaid coverage. Mental health and addiction services, for example, are inconsistently covered depending on state policies. This results in unequal access to care across the country. The United States faces a huge crisis when it comes to mental health and addiction. Leaving it up to the state to determine what will be covered truly gives lots of inconsistency and creates inequality. A reform on coverage and providing equal coverage to everyone can truly help eliminate lots of problems. Having to send a loved one to another state in order for them to have better options for treatment would definitely pose a huge financial burden on families. Financing challenges. According to Gangamore, Medicaid's financing is complex, with high costs driven by populations with significant needs, such as the elderly and disabled. Changes in federal funding can strain state budgets, forcing them to make cuts or restrict access. The 2025 legislation threatens to further reduce provider payments, potentially worsening access problems. Recent changes coming into health policy will make dramatic cuts, and we have not yet fully seen the extent that it will affect the United States. In the incoming years, we will see the negative impact that it will have on disabled and elderly populations and many other Americans that will be affected by the policy reforms. Improving reimbursement strategies, expansion of managed care, capitation and risk adjustment models, fraud prevention and compliance monitoring, CMS 2024. To address low provider participation, some states are increasing reimbursement rates for certain services, particularly in primary care, obstetrics, and behavioral health, CMS 2024. Managed care models, capitation payments, and fraud prevention strategies are also being used to improve efficiency and ensure quality care. Medicaid's reimbursement structure is deeply influenced by managed care expansion, risk-adjusted capitation systems, fraud prevention programs, and population health strategies. CMS plays a leading role in ensuring that these elements operate efficiently and in alignment with Medicaid's broader goals. As enrollment grows and care models evolve, the system's ongoing integrity and effectiveness depends on balancing cost control with high-quality, equitable care delivery. Innovations in Medicaid, value-based care models, telehealth expansion, integrated behavioral and physical health. States are testing value-based care models that tie payments to patient outcomes rather than services delivered. Telehealth has expanded access, especially in rural areas, and integrated care models combine behavioral, physical, and social services for better patient support. Telehealth, in particular, has been very essential to many patients that experience issues with going to a provider's office for various reasons, and it now gives them the opportunity to still get the care that they need while being at home or with a family member. Potential solutions. Key recommendations include increasing reimbursement rates, expanding Medicaid and non expansion rates, simplifying enrollment processes, and providing more flexibility for state innovation through waivers, according to MACPAC. Simplifying the enrollment processes might become more difficult going forward as there has been new eligibility implementations that have to be met in order for a patient to have coverage. It also leads to potential gaps in coverage if a patient does not know how to properly follow the timelines. Maybe more community outreach can be done to help patients that are having difficulty with enrollment so that they can stay on top of their eligibility redetermination dates. But truthfully, increasing provider reimbursement rates would be one of the main target solutions to help overall and make America's healthcare system better. Medicaid strengths covers 40% of U.S. children, strong economic engine and job creator, lower per capita costs than private insurance, average cost per enrollee $7,593 in 2021. Midget 2025, Coleman 2024. Medicaid strengths include its coverage of 40% of U.S. children, strong economic impact, and lower per capita costs compared to private insurance. Midget 2025, Coleman 2024. Its administrative efficiency also keeps overhead costs low while serving populations with complex needs. Medicaid is often more cost effective on a per capita basis compared to other types of health insurance, mainly due to its lower provider payment rates and administrative efficiency. According to Coleman 2025, the average per enrollee cost in Medicaid was about $7,593 in 2021, significantly lower than per capita spending in private insurance plans. This lower cost is partly attributed to Medicaid's ability to pay hospitals and physicians below the rates paid by Medicare and private insurers, which reduces overall expenditures without necessarily compromising access or outcomes. Medicaid challenges: strained state budgets during downturns, provider shortages limit access, unequal coverage across states, Gangamore 2025. Challenges include fiscal pressure on state budgets, provider shortages, political resistance to expansion, and variation in coverage across states. Addressing these requires both policy reform and sustained funding. In recent days, Trump's proposed Big Beautiful Bill passed. This bill poses a major threat to the American healthcare system. Providers were already paid so little through Medicaid. This new bill will significantly reduce payments. Unfortunately, this could mean more providers will stop accepting Medicaid, costing patients lots of money. An article, Medicaid Overhaul in the Big Beautiful Bill Doc to Doc series. Reduced state funding and frozen provider taxes pressure states to cut rates or narrow participation, hurting clinics, hospitals, and specialty practices. There's a forecast of billions in losses expected over 10 years for hospitals. Gangamore 2025. Medicaid was already in a fragile state, and this new bill is going to affect patients in a way we have never seen before. Fragile lives are at stake, and underserved communities will have a negative impact. Another important factor that can also affect Medicaid is state discretion over what services are covered. With many people on Medicaid having disabilities or mental illness, it is important that these patients have the coverage that they need. Alternatives and innovation. Public option based on Medicaid pricing, telehealth expansion, integrated care, linking health and social services. Whaley and Mary 2025. Potential alternatives include federalizing Medicaid to standardize coverage, creating a public option with Medicaid like pricing, expanding telehealth services, and developing integrated care systems that link healthcare with social services. Whaley and Murray 2025. Policy recommendations. Raise reimbursement to expand provider networks. Simplify eligibility and ensure continuous coverage. Encourage innovation via 1115 waivers. MAC PAC 2025. Recommendations focus on raising provider payments, simplifying eligibility, ensuring continuous coverage, and promoting innovation through waivers. These steps would strengthen provider networks and improve access for the beneficiaries. The MAC PAC June 2025 report notes that CMS has approved Section 1115 demonstration projects requiring states to boost payment rates in these areas in exchange for additional federal funding supporting social determinants of health. MAC PAC 2025. These rate enhancements are intended to address long-standing provider reluctance to accept Medicaid patients due to low pay and to improve access to care. The report also advocates that Medicaid expansion in non-expansion states remains a key solution to improving access and equity. MAC PAC highlights that states which expand coverage under the ACA saw higher enrollment, better revenue streams for providers, and reduced uncompensated care. While expansion is optional, the Commission recommends continued federal incentives to encourage remaining states to adopt. Ethical considerations. Healthcare justice and equity, addressing disparities across states, balancing costs with patient access. Medicaid policy raises ethical questions about equity, justice, and the role of government in ensuring access to care. Policymakers must balance cost control with the obligation to protect vulnerable populations. Conclusion and future questions. Medicaid remains essential but under strain. Future depends on policy and funding reforms. Should Medicaid be federalized for equity? Medicaid is essential to U.S. healthcare but faces ongoing challenges. The future depends on policy decisions, funding, and innovation. Important questions include whether Medicaid should be federalized for equity and how states can balance innovation with fiscal responsibility. I hope that this presentation truly highlights how important Medicaid is for the United States healthcare system, and it begins to make you question how current policies can affect you, your loved ones, your neighbors, in the next coming years, and how it can affect you if you are ever in the situation where you need Medicaid. I hope it makes you critically think about how important it is to advocate for the health of everyone. Thank you.